My name's Christine Hirsch. I'm a pharmacist and lecturer in clinical pharmacy on the M.Pharm degree course in the School of Life and Health Sciences. The Medicines Management Suite was designed specifically to enhance the experience that we can give our students with respect to clinical pharmacy. It allows us to give the pharmacy students details about simulated pharmacy case scenarios where they have to formulate a response. We can send them the details through the computer system, and then they can access, as they would in real life, the information from the internet to try and resolve the problems that they have and produce pharmaceutical care plans for the patient. The tutor can go around to the groups, we can see what they're researching, which sites they're looking at, direct them to those which are perhaps more reputable sites than others, or where they can get reliable information. And we can also interact with their process of thinking as well, so making sure that they're looking at the right information first and processing it in the right way to make the best decisions for their virtual patients. The students have expressed that they actually enjoy working in the suite. I think they like the fact that the cases that they're presented are a little bit more realistic and lifelike. They can have coloured pictures, we can have representations of x-rays, but also the fact that they can immediately access any information as they would normally in either their hospital or community environments. As a student, it replicates real life for them. They're going to have to deal with computerised prescriptions, with computerised medical patient records, which are already available in some hospitals, and it's moving towards replicating what they're going to see in the future in their careers. We also feel that there's potential for using the suite for assessment purposes. We have piloted a couple of assessments where students have been sent information electronically through the system to their own individual screens. They then respond to the problem that's been sent to them. They are allowed to access the internet to formulate care plans for the patient and then submit these electronically. In addition to being able to provide a more realistic view of the patients, I feel it's much greener, because if we don't have that available on the screen, we end up copying lots of or reams of paper with the same information on it for the students, which has to be a green advantage to the room as well. As a tutor, I've really enjoyed teaching the students in the Medicines Management Suite. It almost allows you to conduct a large group session as though it was a much smaller group session. You can set the students a problem to work through sequentially, you can move from group to group, but also if you pick up bits and pieces that you'd like to share with the other students while you're doing this, you can either project it up onto the screen or stop the session and share it with the whole group, which is a huge advantage to letting the students go off in small groups and do their research and come back when you might miss some of these procedures that happen during their research process.